I've been involved with antibiotic stewardship for a very long time. Before coming to the CDC, I was actually at Johns Hopkins, and I started the antibiotic stewardship program at Johns Hopkins when I joined the faculty there. And so I'd long been interested in antibiotic stewardship, and after working at Hopkins on the faculty for a couple of years, I took a job at the CDC, and since then have been peripherally involved with antibiotic stewardship. But about 5 or 6 years ago, CDC decided that we really needed to be doing a lot more on improving antibiotic use in hospital and other inpatient settings. For a very long time, CDC has had what we call the Get Smart program, which has been focused on improving antibiotic use in outpatient settings. But we didn't have a parallel program focused on improving antibiotic use in hospitals and nursing homes and other types of inpatient settings. And so in around 2009, we started a program called Get Smart for Healthcare, which is designed to be that parallel program that really focuses on trying to improve antibiotic stewardship in hospitals and in nursing homes. Some of the big focuses of the program and the big initiatives, very recently, they've been the development of what we call identifying the core elements of antibiotic stewardship programs, first for hospitals, which we released last year, and then for nursing homes, which we released this year. And what we attempted to do in those documents is really try to outline for people what are the core elements, the things that make stewardship successful, based on what's been published in the literature, based on input from experts, because we know that there are some very successful antibiotic stewardship programs that are out there and really doing amazing things. And what we tried to do is identify not the staffing of that program, do you have an infectious disease doctor, or how many do you have, and how many infectious disease pharmacists do you have, but really, what do those infectious disease specialists and pharmacists, what do they do? What does the program look like? What is the structure of it? And then what are the activities that really lead to success? And we were able to kind of distill it down into 7 very overarching core elements that interestingly and strikingly were the same in both long-term care and in hospitals. The real kind of structural elements and the activities that need to happen are pretty much the same. They look different in hospital settings and in long-term care settings, and they also look very different in different types of hospitals. So we know that an antibiotic stewardship program that's serving the needs of a 1,200-bed academic hospital with an organ transplant program and a bone marrow transplant program, that stewardship program looks different than a stewardship program serving the needs of a 25-bed critical access hospital. But the core elements, the things that those stewardship programs fundamentally need to do, look the same. What we're pushing for is for all hospitals and all nursing homes to implement these core elements in their facilities. And what we've said is that there's lots of different ways that you can go about doing this, and one of the things that we're trying to do is work with all the partners that are out there to identify some of the different options for implementation, because we'd like to be able to show people, look, this is a different ways that the leadership, for example, is one of our core elements. These are the different ways that people have found a way to get support from their leadership for antibiotic stewardship. Specific actions to improve antibiotic use are another one of our core elements. And obviously there are a large number of different actions that facilities can take. And so we're looking to try and identify those, lay them out for facilities, and say, we in no way intend to dictate to you which action is the right one for you. That's something that you decide based on your local needs and what's relevant to you. We, though, want to provide a menu of options that you could potentially choose from, but critically it's to highlight that you do need to take some action in order to improve use. Which one that is depends on your local needs. So we've really tried to be sensitive to trying to identify at a high level what needs to be done. We're trying to work with partners to identify specifically what are some of the options for doing these things, and then we really want to leave it to the local experts to determine exactly which ones they do and how they implement it.